Good morning everyone. Today I will be teaching you on the tumor markers in the oncology. So let us start. What is tumor markers? Are the substance are produced by the cancer. The cancer cells which are there in the body, because of them tumor markers are released. So various sites in the body, we have liver, we have breast cancer. So you will see. Let us see in this today. So in the PPT you can see the when we are doing in tumor marker cell, the sensitivity are high. Okay, sensitivity are very much high, and it should be early in progress when the disease is progressing. So the tumor marker should be, when we are doing testing, it should be the detectable level. Okay, so site specific. It's not like if we are doing some PSC level. So only in prostate cancer only the PSC level should be high. Again, easily accessible tissues also, and levels and quantitatively tumors, and all these are the basic, and they should be reasonable cost for the same. So if the cost will be same, so it will be very much easy to use that specific marker to detect the thing. Next, so in the diagram you can see from the starting onwards. So this is lung. So in the lung cancer usually you will see CA125 or CEA. In the liver cancer we have AFP, alpha fetoprotein, which is raised for the tumor. We can say PSA level, which is increased. In testicular cancer we have AFP level, STG level. So if let's see the other side of this picture. In the breast cancer usually CA125 is the main. Stomach cancer CEA is raised. In pancreatic cancer we have CA125. Similarly in ovarian cancer we have CA125. Okay, so let us start one by one, and you should be very much clear with all these levels. Okay, so uh, it does not mean one tumor marker has been done and you have to do a complete confirmation about it. So you should be very much clear that if anything other sample also needed for any kind of FNAC, we should go for that to rule out the marker for that. So let us start with AFP, that is known as the alpha fetoprotein. It's one of the major plasma glycoprotein produced by the yolk cells of the fetal liver, Kupffer cells and all. So usually what happens when the AFP is very much high, you should be very much clear that in case of anything related to your hepatocellular carcinoma, AFP is high. So any kind of liver cancer, AFP is high. So you can see in this image. Next, let us see what is CEA. CEA is also known as a carcinoembryonic antigen. CEA, that is carcinoembryonic antigen. This is a kind of glycoprotein. Okay, CA usually you will see it has been raised in colorectal cancer, in gastric cancer, in case of pancreas. So CA in many cases these markers are being levels are high. So whenever we talk about the GI system, so colorectal cancer, gastric cancer, all these levels CA is high. Okay, and you should be very much clear. Next is PSA. PSA is very important. That is known as a prostate specific antigen. Usually this level is high when a patient is of BPH, that is benign prostate hyperplasia, PSA level. Okay, so उसमें BPH का this PSA level is high in case of BPH and all. So you can see in this image we have a BPH patient. So how when there is a cancer tumor marker cell is PSA. Next is CA125. CA125 usually we will see in case of people who are having this ovarian cancer or not. So in those cases you will see an increased level of CA125. Okay, so let us see CA19. CA19 usually is increased in case of people are having pancreatic cancers and all. Next is beta HCG. The beta HCG we have very much heard in case of during pregnancy, but beta HCG patient who are having a gestational trophoblastic neoplasm. So this is kind of pregnancy where there is not an actual pregnancy, but there is a gestational trophoblastic diseases, because those trophoblasts goes on differentiating. Okay, so this is CA15 is also there, and the calcitonin is there, which is usually increased in the thyroid carcinoma cells and all. So this was a small glimpse for the tumor marker cells, and you should be very much clear with the which level increases at first time. So thank you very much.